You guys, and welcome back to my channel. So my name is Patience and I have a daughter named Paradise and she's 5 years old. That's why my channel is named Patience and Paradise. For you guys who aren't familiar with my channel, I make a lot of dental assisting vlogs. That's probably how a lot of you guys are familiar with my channel. I am venturing out doing like other things, but today this video is strictly about like dental assisting stuff. So in my last video that I had posted about dental assisting, I had asked you guys to kind of comment below and let me know some stuff that you guys had questions about. So right now I'm just going to go ahead and see if I could pull up the questions that you guys had. For some reason it's taking forever. We'll just close out my video. That just irritated me. But so if I can, I'll see if I can tag you guys in it, which I don't know how to do that, but Hair Smart MK Up Makeup, kind of slow. She posted and she said, hey, glad to see you post about dental assisting. I would love a video on job hunting interviews, working interviews for a new assistant. Also talking about patients, walking patients back to the room, and also front desk advice. Do you like private or corporate? And then racism is in the dental field. Is racism in the dental field? She asked a lot of questions, so I'm gonna try to answer all of them. So we'll start from the bottom to the top. I feel like I could do it quicker that way. Is racism in the dental field? I can't speak on racism in the dental field for other states. I'm not quite sure what you guys encounter, but all throughout my career, I would say yes. Because 9 times out of 10, I've always been the only black girl in my office that I've worked at. Almost all the time. Until I started working for jobs that's in the city, like downtown. All the jobs that are more in the suburban areas where I live is majority predominantly white people. You will find occasionally some black people here and there, but majority is white. Not saying that they are racist, but you just don't come across a lot of black people. Have I worked at offices where they were racist? Yes, I have. The office itself isn't racist, but the patients were racist. If you guys live in Illinois and you guys are familiar with I'm trying to remember what it is. It starts with a B. It's a city in Illinois. It's not like Burbank or nothing. I can't remember the name of it. It was years ago, but I worked there for like 2 days because I worked at an office that was like a corporate office, so it had multiple chains. And so that office that I worked at, it's like right on the tip of my tongue, but I cannot remember the name of it. It's gonna irk me. If I remember it through the video, I'm just gonna shout it out because I don't remember. But Bourbonnais. If you guys live in Illinois and you guys are familiar with Bourbonnais, they have a lot of racist people out there. At least what I encountered when I worked there for 2 days at a dental office. It was so bad to the point where the male that I was working with was asking if they had another assistant available because he did not feel comfortable working with me. Like, yes, I have encountered a lot of racist patients before. That's just one of them. So we'll go to the next question. Do you like private or corporate? I love me some corporate, okay? Love me some corporate. Private offices are great if you can get in and find an office where they pay well, where there's no, where you don't have to deal with being overworked, not enough assistants, not enough employees, because 9 times out of 10, a lot of private offices, they don't have a lot of employees. They don't have a lot of assistants. It's usually one doctor who works 2 columns, and honestly, you might just be the only assistant. So I've dealt with that a lot. Sometimes usually it is 2 of you guys, but most times it's one of you guys, and you're working the whole schedule. And sometimes it can be packed. Sometimes you're booked with long procedures, and then sometimes it's like absolutely nothing. So you're there all day dragging along. So yes, I don't like private offices. Corporate offices I like a lot better because there's always multiple doctors, there's always multiple assistants, it's much more operatories, it's just so much more, and it's a lot of larger offices, so it's a lot more to do. Because I'm the type of assistant, when I was younger and I was eager, I was like, I'm gonna find me something to do no matter what. But now that I'm older and I'm like, I've been doing this for a long time, I'm not gonna do too much. Like, I'm just not. If I don't have to, I'm not gonna be sitting around trying to find me something to do, sweeping floors, just doing the extra. I'm not gonna do all that. So I prefer corporate offices better. Corporate offices usually pay more, in my experience at least, because I go downtown. They just pay more because they need more help. It's a higher populated area, so they bring in more cash flow, so they pay out their assistants a lot better. More private offices, they don't get as much business as a corporate office, so the pay isn't that great because they're not making as much production. Also talking to patients and walking patients back to the room. It takes a long time for you to get comfortable with talking to patients. It took me a good minute to actually feel comfortable enough to get over my shyness, because I was a shy person. I still am shy when it comes to certain things, but you just have to one day just be like, you just have to know how to turn on that switch of like, I'm at work and this is my professionalism. This is my professional personality. And then you have to know when to shut that off when you're not at work. So a quick walkthrough. When I go and I greet a patient, because I think she said walking patients to the back, to the room. So when you go out to the waiting area, always make sure you know the patient's name, for one. Usually there is a picture of the patient on a profile. If it's not a big deal. If you don't know how to pronounce that patient's name, call them by their last name. If you don't know how to pronounce that patient's name at all, you better pray that they're the only one in the waiting room. Ma'am, sir, because I have no idea. I am really good for asking anybody around me, how do you pronounce that? Because if you don't know how to pronounce it, somebody is going to know how to pronounce it. And 9 times out of 10, it's the front desk lady or male, whoever checked them in. They're going to know how to pronounce whatever their name is. So you go back there, you walk up front, you go all the way outside the door. Don't stand at the door in a little peek at the corner. Don't peek through the door. You walk all the way out there in the waiting room. Mr. Stevenson, that's what I do. If a patient, this is just me, not saying that you guys have to do it. If a patient is over 50, 60, always Miss, Mrs., Mr., Mrs., Miss, so-and-so. If they're 50 and up, I always call them by their first name. That's just how I am. Do it as you please. So you go out there, you say, Mr. Stevenson, wait for them to come up to you. Hi, good morning, good afternoon, how are you doing today? You know, walk them to the back, bring them right to the back. Direct them where they should put their stuff. As soon as you go in the room, hi, there's a hook on the back of the door for your coat. There's a space on the counter if you want to set your wallet or your purse. You know, just let them know what they should do with their stuff. Because a lot of patients walk in and they're just lost. They're just looking around. They sit in the doctor's chair, which is the dumbest thing ever. Direct them where to sit also. So once they put their stuff down, and a lot of them will just stand there after they put their stuff down. You go in, you say, this is where you put your stuff. There's a hook on the back of the door for your coat. Oh, thank you so much. You can have a seat right here whenever you're ready. Point them where the chair is. So once you seat them, place the bib over them. When you place the bib over them, walk in front of them. Try not to talk to the patient when you're behind them. So walk in front of them and say, hi, my name is Patience. I'm going to be working with you today. If it's it's just a lot with this. If it's a procedure, hi, my name is Patience. I'm working with you today. So what we're gonna do today is do a root canal on the upper left side. And did you have any questions about anything? If they have any questions, answer any questions that they have. If they don't, proceed with what you're gonna do next. Well, okay, so what I'm gonna start off and do is I'm gonna go ahead and take an impression of your tooth so that I can make you a temporary at the end of your appointment. Then I'll start scanning your teeth, and then right now, I'm just going to go ahead and start setting up around the room, okay? In a few minutes, I'm going to go ahead and give you some topicals so you can start getting numb. You sure you don't have any questions? Just always give that reassurance, because sometimes you'll go and you'll start explaining what you're doing, and at that time, before then, the patient don't have any questions. But when you start saying, I'm going to take an impression and we're going to do a root canal and then I'm going to make you a temporary, that's when their questions start to flow. So still just give them that reassurance of asking them, like, is there any other questions that you have? Go ahead and set up. If it's a limited patient, walk them in a room, sit them down, blah, blah, blah. Hi, my name is Patience. I'm going to be working with you today. Always look at their chart. When you look at their chart, it should always say why they're coming in. Always look at their health history. I know a lot of you guys tend to think that health history is not that important, but it is very important. And you will have those patients that come in and you ask them just the slightest question. Are you allergic to anything? Oh, I put that in my medical history. Like, you will have them patients that be on that. So just always look. And if you still want to ask the questions, just be like, is there anything else you're allergic to? Because I seen that you was allergic to penicillin. At least let them acknowledge the fact that you did look at their chart. So, like I said, when you see the limited patient, you always know you have a basic. You always know that you take an x-ray on the patient. In that chart, it should always say where they're having pain at or the reason that they're coming in. It should be like pain on upper left side. Teeth feel like they are swollen. Broken tooth on lower right side. It should always say that. So if it says that, you walk up to the patient. Hi, my name is Patience. I'm working with you today. I seen on your chart that you have pain on the lower right side. How long have you had that? You know, you ask general questions because the doctor's always going to want to know certain questions as well. Are you taking anything for your pain? A typical question that you can ask. That way you kind of know automatically if they need a root canal or not. Are you getting throbbing? Does the throbbing wake you up in your sleep? You can ask those type of generalized questions, and it'll kind of help the patient to know at least that you know what they're talking about. If you walk in because for some reason the front desk effed up and they didn't notate anything in the chart, and the patient walks back and you don't have anything in there, they probably had a whole scenario on the phone, but for some reason the front desk didn't notate any of that in their appointment. You walk and you say, hi, my name is Patience. I'm working with you today. What's your reason for coming in today? You know, just put it in a nice way, because you don't want to say what you coming in for. Or you don't want to say you having pain somewhere. You don't want to come off like that. So you just say, like, what's the reason for you coming in? Are you having pain anywhere? Is there anything that's going on with your teeth? Are you having sensitivity anywhere? You want to talk about it in a nice way. And you want to make them feel comfortable, and don't make them feel worried, because I can guarantee you almost every single patient that comes in as a limited, they are worried and stressed in some type of way. So make them feel comfortable. She said also any front desk advice. Front desk is like a whole nother topic. I worked front desk when I had my very first dental job, and I liked it, but I liked action more. To me, front desk was just not enough action for me. Front desk is checking in patients, answering phones, scheduling appointments, handling, billing, insurance verification, which I hated that, and collecting payment. It's a lot that ties into it. And also treatment planning, treatment coordinator. It's a lot of things. If you feel like you are the type of person that can handle a lot of clerical work, or likes tedious things, or likes to answer phones and talk to people a lot, if you like to deal with rude customers, or if you are just really good at explaining things, if you are good at just being on the phone for long periods of time, if you are good with, typing out and liking to constantly have to fill in patient information, then the front desk will be a good option for you. If you like to go in the back and present treatment plans and explain treatment to patients, then that'll be a good option for you. If you are good at numbers and good at calculating things real fast and good at making payments and setting payment plans for patients and explaining insurance benefits and breakdowns to that, then front desk will be an awesome job for you. Just wasn't what I wanted to do. And then also, if you do front desk, just know that you are a great candidate to then be approved to become a manager one day, because usually 9 times out of 10 patients People start off as dental assistants, they move to front desk, then they move to managers. I can't tell you how many managers I've ran across that were dental assistants at first. So if you start in the dental field, there's always room to just move up. She said, we'll do working interviews for a new assistant. When you first do working interviews as a new assistant, if you got the balls, you can ask for pay. You can ask to be paid for your working interview. You definitely can. But usually that comes with more seasoned or experienced assistants. They usually ask for paid working interviews, which that's usually what I would do. I would always ask to be paid for my working interview. I'm not finna go to work for y'all get a free day up out of me for nothing. But if you are a new assistant and that's just something that you want to dip your foot into, and especially if it's an office that you like, then yeah, I'm doing it for free. You could do that as well. Working interviews, of course, you come in your scrubs. Just be prepared to be thrown around. A lot of the times when you come into the office and you do a working interview, they're not just going to throw you somewhere and they just expect you to just know what you're doing. I've done that before though, but I've had a lot of experience. You'll usually pair up with an assistant and you'll go in the room and she'll tell you you're working with this doctor on this procedure. And they might leave you in there, or they pretty much will leave you in there, because if it's a working interview, they're just trying to see what you could do. But I don't know how things have changed recently. I can only talk from experience of what I've seen from the working interviews that have came into my office. A lot of times you'll have the lead assistant or pair up with the new assistant that's doing the working interview, and she'll have you take x-rays on her. She'll have you chart. She'll have you just do like the basics. That's some of the things that you might encounter in a working interview. But the working interviews I've done is they just pretty much put you in there. You're thrown in there with the doctor. This is what you do. You ask the main assistant where this, that, the third is. You find out where it is and you're working with them for whatever amount of time that they say that you're supposed to be there. Sometimes the doctor might ask you to make it temporary. Sometimes he may ask you to just do a basic filling with him, and usually fillings are universal. All doctors pretty much use the same thing. So just be prepared to just be prepared to just be thrown into something when you do a working interview. Let me see if I can answer this other question. Job hunting interviews. So job hunting, I haven't been job hunting in a minute because I've been at the job that I've been at for like 3 years now, which is a lot for me because I like to move around, which I'm about to do that pretty soon because I'm kind of tired of assistant anyways. But job hunting can be kind of stressful. It kind of just all depends on what exactly you're looking for, because they're always looking for assistants, but it's like the pay grade that you're willing to take. And now I see anywhere from like, they really try to hit you with the low 13 to all the way up to 25. And usually 25, 26 is about the sweet spot where you can like, where they will pay you is anywhere from $13 to 26. $13 usually will hit you when you have zero experience and they're willing to train you on the spot, which if that's what you want to do, which I wish I would have went that route, that way I wouldn't have to worry about paying back a student loan, then I would do it that way. So they would start you at 13. But when I first started, I was getting paid 10. They started me off at 10. That was back in 2013. So they started me off at 10. But job, I mean, it's just kind of, I don't know. Job hunting is just, it just takes time. The place where I've always found jobs, almost all of my jobs have always been Indeed or either Craigslist is where I've always found all my jobs at. You just basically go up there and just fill out applications. A good trick though that you could do when you do, at least that's what I do now because I just don't have time for the extra stuff. When I see a job that I like, I will send my resume up there and I will call up there and say, hi, My name is Patience. May I speak to, is the hiring manager available? And usually they'll say, yeah, she's available. May I ask who's calling or what's the reason? I said, I sent in my application and she told me that she was going to get back to me with a time for my working interview. You know, you got to just push it. Because you sit up there all day trying to wait for those people to get back to you, they're never going to get back to you. So usually I just always call up and say, hey, I already have a working, I was waiting for her to get back to me with the time for my working interview. Or she had reviewed my resume. She said she would give me a call back, just giving a, you know, just giving a friendly reminder or anything like that. Like, I will call. If I'm really thirsty for a job, and I've seen it on Indeed or I've seen it on Craigslist and I know it's close by, I will drive right up there and just drop my resume off and said, hi, can I speak to the hiring manager? And make sure you speak to the hiring manager, because if you speak to front desk or any other assistants, they be petty. They will not give you your, they will not even pass off your resume. They be petty. So ask for the hiring manager. Introduce yourself. Hi, my name is Patience McCray. You know, I've been doing dental assisting for this, that, the third, many years. I'll just give you guys my application. I know that you guys are looking for an assistant. I am available tomorrow if you guys need me to come in for a working interview. If you really want a job, you have to really push yourself out there. You sitting back, sending your resume out there online and thinking that they're going to call you back, you can't just be waiting on anything. You can't wait for anything in life. You have to go out there and just push it out there if you really want it. So that's usually what I do. Especially if I'm in the middle of, I don't want to deal with this job and I know I'm about to move on to something else. Best believe I'm going to have that next job before I quit the one I have right now. I'm just trying to see if I answer all her questions. I think I did. And then, okay, I'll answer this last question. And I'll answer this one time only because I keep getting this same question under all my videos. And everybody keeps asking me the same question, same question, same question. I answer it, but nobody really watch. I guess they don't see it in the comments. You guys keep asking me, how much do you make an hour? I make $29 an hour. Yes, and I've been an assistant for 10 years. I make $29 an hour. Yes. Do I work full time? No, I do not, because I don't have it in me to be sitting up there on my feet for 12 hours every day and just working full time. I work 3 days a week and I work half days. And you might catch me on every other Saturday. And that's it, because I just don't have time to be doing all the extra stuff. No. I still have my cosmetic line that I'm running. I'm doing my YouTube now. I just have a lot of other stuff going on. I'm trying to focus on doing other things too. So yes. So this is a quick, not really quick, it's like 20 minutes, but this is a dental assisting video. I hope I answer all of your questions. The lady who asked me all the questions. Like I said, if you guys have any more questions, please post them in the comments below. And if you guys like, I can make separate videos just like I did with this one to answer all the questions that you guys have. So thank you guys for commenting, rating, and subscribing. And thank you to all my subscribers who are currently tuned in and are watching all of my videos, everything like that. Check out my new ones. And thank you so much for watching.